Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing the latest techniques in facial rejuvenation and how they can help you regain that fresh, young look with one of this area's top oculofacial plastic surgeons, Dr. Hormozi. Dr. Hormozi is board certified and graduated cum laude from the University of Brussels Medical School in Belgium, one of the top medical schools in Europe, and has completed his ophthalmology residency at Maryland General Hospital in Baltimore, Maryland. He is the leading oculofacial plastic surgeon in the United States and gives lectures on state-of-the-art bladeless radiosurgery nationwide. Welcome, Dr. Hormozi.
Thank you.
It's great to have you back a third time now to educate us and enlighten us on the latest techniques in facial rejuvenation. I understand we have a lot to talk about today, not to mention a patient that's going to be joining us as well shortly. So let me just start off the bat by asking you, what are these latest techniques that can make us look years younger and feel great?
There are different things to address in the face. One is the frown of the eyebrow area and the forehead that a lot of women and men don't like because it gives them an angry look, even though sometimes it's there without any facial expression. It's just there. And that is treated with Botox. Botox has been on the market for over about 15, 16 years and is FDA approved. Botox, what it does, it's a product that is injected into the muscle, and selectively you can paralyze 1, 2, 3, 5 muscles depending what you're looking for. So in the frown area, there are 6 muscles that involve in bringing the eyebrows together, and when it's done correctly, you can address all those muscles, and basically you feel like you're frowning, but nothing happens and nothing shows, and that's what people want because it gives them a happier look. They don't have that angry look. I have patients who say, you know, my kids always tell me, why am I so angry? And I'm not angry because I just have this frown line in the middle of my eyebrows. So Botox addresses what we call the crow's feet around the corner of the eye. The outside corner, they don't like the aging effect and the lines in the corner of the eyelids. So by injecting those muscles selectively, you can paralyze that section of the muscle so the crow's feet disappear. Now, long term, when you do it periodically every 4 months, what happens is those muscles get weaker and weaker because they're not exercising during that 4 months that they've been paralyzed. So they lose a lot of their bulkiness. And I have patients after a while, they say, I don't need it anymore because I have my expression. When I get angry, I can show it, but when I'm not angry, nothing is there anymore. So Botox is not something you have to do all your life. In general, after several treatments every 4 months, you can stop it and get the look that you want it without having to do anything anymore.
At that point, it becomes permanent, like you said, basically, because of the number of treatments that were done over a period of time.
Absolutely. Now, there are other things. There are, for example, nasolabial lines or a deep frown that even Botox cannot handle it because you can paralyze the muscle, but the skin has deepened so much and create a crevice basically there. That needs something else to plump it up. And basically all the fillers which are on the market, they plump up the skin. So if you have a nasolabial line, which are deep, you can plump them up so it doesn't show as much. So people who don't want to do any facelift, or it's too early for them to have a facelift, these less invasive procedures, which are not basically, you don't have a downtime per se, it's just you come in the office, it's injected, it takes 5 to 10 minutes to do all the injections, and you walk out. At worst, you have a little bruising because one capillary has leaked, but a lot of time there's nothing whatsoever, and they put makeup on and go on. You can put makeup right away over that.
So they can just come during their lunchtime, have it done, Botox or some of the other fillers that you're going to be describing,
Absolutely.
and then basically go back and nobody will even know anything was done?
Absolutely. And I have patients who come the day before a wedding. They do that, and they look much better, and
Right.
without having to do too much about it. Now, but Botox takes about 7 days to have a full effect, but the fillers, the one I choose and I use is the Juvederm. I think is one of the best one on the market, has the least amount of side effect. There's no allergy associated with that, and it gives the nicest, most natural result when it's injected on the nasolabial line or the marionette line and the corner of the lips. As we get older, the corners start sagging down, so they can be plumped up. All these basically are temporary, but the fillers like Juvederm last about a year to 14 months.
Okay.
It's quite a bit of time that you can gain without having to do a more invasive mini facelift surgery, because these are not surgery like the facelifts, but it's more a filler effect around whatever is sagging, basically.
And that's what you actually were on last time to tell us about, was the mini facelift.
That's correct. That's correct.
Now, who would be a typical candidate for these fillers and these treatments that you've described?
These candidates are the ones who are not ready to do a facelift. They feel that at this early stage of sagging of the face, lines are becoming a little bit more pronounced, but they don't want to go through the surgery yet. The frown could be any time. I have patients who are in their 20s and they come for the Botox injection because they have the habit of frowning, and it makes them look angry in their job, and they don't like that look, and it can go all the way to 80, 90 years old who don't want to, they want to look better and not have wrinkles or in the forehead or frown between the eyebrows and the crow's feet. I do not recommend doing, and I know some people do, I do not recommend injection of Botox around the lip area. It gives a very unnatural look to the lip, and also it creates problems that it should not be created by injection. But ideal patients are the one who do not want to do anything major, or is just early stage and they just want to plump up things and make it look better for several years before they go to the next step if they desire to do a surgery.
Okay, no, very well said. I think that certainly helps us a lot to understand. As far as results, doctor, what are we looking at?
The result is basically the same person looks the same, except either if it's by Botox, they have lost the wrinkling of the forehead, the wrinkling between the eyebrows, which is the frown lines, the crow's feet around the eyelids, but nobody really noticed except the fact that you look fresh. So these small adjustments that you do with Botox and fillers, they just refresh the face and take the angry look away. They take the tired look away. That's all they do. They don't give you a facelift. They don't give, they don't do anything major as opposed to just to make you look fresher. That's the type of result, and you will see in the pictures that patients before and after, you can see the frown line, and the frown line has disappeared. As I say, it takes 5 to 7 days for the Botox to work. And if it's injected, the Juvederm and fillers are injected, they make the lines around the nasolabial line and the marionette line less visible, and refresher look to the face.
How safe are these treatments, doctor?
If it's done properly in a physician's hand or surgeon's hand, they're safe. Botox, as I described before, it's a toxin, that's correct, but if it's injected to the muscle, it doesn't go anywhere else, it doesn't create any side effect. Some places there are salons, then people who are not qualified are doing these injections, but that's not right, that should not be. This is still a medical device, it should be in the hands of a surgeon or a physician who is trained in doing that. But if it's done properly, they don't go anywhere else, and the doses used for the wrinkles are so small that they do not create any side effect. Actually, as you know, I'm an oculofacial surgeon. We used this years ago to create spasm of the eyelid, and that was incidentally found out that when you inject the people who have spasm of the eyelid, you get the wrinkles to disappear. So it became more and more popular to use it for wrinkle, but we have been using it much higher dose without any problem and any toxicity. So if it's done properly in the proper hand, there is no side effect. The fillers, there are many on the market. Some of them have side effects like being rejected by the body because they are not accepted in everybody in the same way. I use Juvederm, which is made in the lab. It's a type of sugar which is